मायक्रोफोन आपण त्यांच्या ब्लूटूथशी याला कनेक्ट करायचं.
नंतर फोन करता का मॅडम जर प्रोग्राम सेटिंग करा एका ठिकाणी. नाही प्लेसमेंट प्लेसमेंट कुठे आहे ब्लूटूथ मॅडम? ब्लूटूथ कोणाकडे? कोणाचा?
स्टेशन तेच म्हटलं.
त्याचं ब्लूटूथ मोबाईलला कनेक्शन. हा मॅडम होतोय का? मॅडम आवाज येतोय का? नाही माझा आवाज येतोय का? बघा ना युट्यूबला.
Only a billion people. We have presence among 137 countries. That includes our commercial presence, R&D sites, manufacturing units. Approximately 29,000 employees. And if I talk about the Guinness Company ranking, it's 16. Not only this, the Boston Scientific also believes in the community outreach program. Approximately 42,000 plus hours of service as part of community outreach. So we are trying to transform lives through innovative medical solutions, through innovations. And if you look, one more word which is very critical here, collaboration. Collaboration with doctors, clinicians across the world. Now, there should be one question. Why a company like Boston Scientific is standing here talking to you guys? Because this is our part of collaboration. I myself am a mechanical engineer. If you look at my fellow team members, some are computer science engineers, some are electronics, some are coming from biomedical background. So this is an example of good collaboration. Although anatomy is part of it, but engineering remains the core of our innovation, or for that matter, any innovation. Hence, that defines, that tells you the reason why we are here and why we are having a program like STEM with people like you, with the students of engineering and technology. You can go to the next slide. Now, what is STEM? The acronym is Science, Technology, Engineering, and Mathematics. Through STEM, BSc is dedicated to collaborate with global and diverse innovators, the innovators of different ages. Because in our belief, innovation does not start after you have a degree, or innovation does not start when you are working for a technological company. It starts in whatever you do. That is where, if you look at our STEM plan, it starts at a very early childhood. And we have different plan depending upon their cognitive skills at that particular point of time. And we have kind of segregated it into early childhood, 5 to 10 year olds, 11 to 14 years old, 15. And then we are also collaborate with the colleges, engineering colleges and organizations in order to provide them, in order to increase a student's aspiration, ability and access. What is aspiration? Is your own aspiration, is your own zeal to do something, to innovate. And as a part of this, this is an opportunity for you to convert your aspirations into doing something more meaningful, which we call as innovation. Now, if you look at the objective of this whole program, to develop a high-level understanding about the process innovation and various aspects that need to be thought around how innovation and product development is managed in large multinational corporations like Boston Scientific. And during this process, when I'm talking to you, after me, there will be speakers who will talk about these different aspects. Our team members from HFID, they'll talk about the process of ideation. Our fellow colleague who normally takes care of intellectual property, still talk about how to protect a constructive idea, a robust idea, when you have kind of developed. Then we are having the speakers who will talk about the new product development methodology which takes place at Boston Scientific. And then there will be a product demo through case study by our R&D colleagues. And at the end of the day, we'll talk about the contest, the problem statement of the contest. And at the end of the day, we'll be having some time for question answer. Now, if you look at all these agendas, those are interrelated, because since there is a contest, there is a problem statement. We want you to understand the ideation and understanding needs process, intellectual property, what does it mean to you? And then we'll also take you through new product development as part of the agenda. Now, from a BSc leadership, I mean, this initiative has been driven from top. And that is where our BSc India leadership team will talk about the STEM and its importance for college students like you. Yep. Is it audible? Just give us 1 minute. We are changing the settings of the speaker right now. Excuse me. I know audio was having some issue, but these are our Pune campus leaders talking about the importance of innovation and what does it mean to Boston Scientific as a company. Now, as part of our next agenda item, we have a virtual Boston Scientific trip where the different processes are involved through one of the leading comedians, Juice. Okay, he will take us through different aspects of Boston Scientific and its innovation. You can look at the different processes which are kind of involved, and this is just a kind of a glimpse of it. It's not the complete story. So over to the next video, which will take you through a virtual trip of Boston Scientific and its process.
प्ले करो मैं बात कर So this is the site which is there in Marshall Grove. They will take you to different facilities we have, how we develop the product, and how we use different innovations to develop the product. These are different labs we have in Minneapolis. All our labs are actually paid, so everybody who visits the lab needs to wear this protector outfit. This lab actually manufactures embolic beads, which is used for killing cancerous tumors. This is how these embolic beads. So these are the beads which gets implanted into the passage where you can see that's a tumor, and they will deliver this bead. So what it happens is it just blocks the blood supply to the tumor and eventually kills the tumor. So that's what she is explaining. So she's explaining that her mother had a cancer, and that actually kind of excited her to work in this. So this is a simulation model which we have in our lab. So that's called as we call them as a Duke model. It simulates the entire vascular and arterial pathway through the body. So you can see the hand and Correct. It's okay. I'll No, it's okay. It's okay. Yeah. All the equipment are in-house, so we do manufacture all our majority of our critical components in-house. So we don't outsource. This is a typical art or just say. is explaining the manufacturing new technology which are used in manufacturing. So this is a robot which picks up different components. So actually this will help us in kind of reducing foreign matter in the medical devices. If you can get an automation done, you don't need any human intervention while something. So we are not just product manufacturers and designers, so we'll also try to use different methods, different innovation during manufacturing. These are the pacemakers. So we stop the video. So this video is available in the YouTube. If anybody is interested, just type STEM and Boston Scientific. We'll have multiple videos, not just this. We'll have more information about this Boston Scientific analysis. Thank you.
Thanks so much. Thank you so much. Sorry guys for this issue with the audio. Hello.
That's the audio.
So what we have seen is we had the messages from our Pune site
So this is the process. I'm not sure if you are able to see it, but I'll read it for you. So it's majorly three steps: identify, implement, and implement. So we start with an opportunity to solve a problem. For example, if you must have experienced what we had in back COVID, and everyone was vaccinated and things. So there was a lot of opportunity. And opportunity means that there is a problem that needs to be solved. And if you are in the field, you take it as an opportunity. You try to understand what problem are you are going to solve. So first you need to understand in identify phase, there is find the need and then you screen the need. Finding the need means go into the field and try to see what is happening, what the users need, what the patient needs. And there will be an n number of needs. You need to screen those things. That means you need to give them priority and solve those by their priority. In invent, you need to actually try to come to some solution to those things. And in implement, you need to make a plan to actually solve that problem through a product. So after implement, there is the product launching. Like in industry, we have a product, we have tested it, we have gone to the field, you have taken feedback from the healthcare professionals, from the physicians, from patients, and we are ready with the product. And that product has to be launched in the market. So that is the executive plan. So what's in it for me, you would say? So as an innovator, you get better connection to your customer and needs if you follow the process. Better decisions that meet customer needs. So your decisions as an innovator in the industry will be much valued by the customer. Clear sets of requirements, that means the clarity in your mind will be increase your skills. You follow you as a job skill, your value in the job market. High probability of success. For success, we just don't follow problem for the sake of it. We need to have success at the end. So there are some beliefs and behavior that we follow. The first, creativity. So what behaviors that we as innovators have when it comes to creativity? Treat all people as naturally innovative. That means everyone has a natural ability to be innovative. So we have to treat everyone equally when it comes to innovation. Consistently encourage everyone to have their creative potential. We need to encourage everyone in the team for their creative potential. Do not limit who innovate or what is innovative. So anyone, ideas can come from anyone. And ideas can sound stupid initially. So we do not have to limit where the idea is coming from and what the idea is. Maybe in the future that idea can have a deeper value. Learning from failure. So you experiment, you fail, and then learn from that failure. You may have to try 1,000 times, but at the end, you will succeed. If you don't try, you never succeed. Recognize and reward risk taking over failure avoidance. So, if you are avoiding your failure in the process, it's better that you take some risk and then fail and understand what went wrong. So, you need to recognize and reward taking risks. Routinely use lessons learned to avoid repeating failures. So, whatever failures that have occurred till now, take lessons. Feasibility. So, clearly define the problem and the success criteria before pursuing. That means when you are trying to identify needs, then you need to understand what is your success criteria. Break down the problem into logical steps problem, like I said, it's not just one problem. There are many angles to it. There are different needs to it. Constantly measure against success criteria. Once you have defined your success criteria, as you go along solving the problem, you measure against that criteria. Okay. Solutions enhanced by diverse collaboration. So at Boston Scientific, we promote diversity and inclusion. That means we take ideas from each and everyone in the team throughout the organization, and we do not exclude anyone when it comes to ideation process. So actively seek creative contributors, constructive critics, and those that challenge us. Okay. Again, ideas leverage from the world. So it's connected to previous slide also. Seek the problem stated and observe of our varied customers and stakeholders. So I'll talk about stakeholders here. Stakeholders here, who are stakeholders? In an organization, it's the management, it's the different departments. These are our internal stakeholders. Subject matter experts are our stakeholders. And ultimately, it's the customer who is the biggest stakeholder. As a medical devices company, our customer is the healthcare professional, the technician, the physician, the surgeon. These are all stakeholders. And at the end, the patient itself is the final stakeholder. Actively seek the input of other teams early in the university. So you take input from different teams. So even if you are working on a project as a team, you can take inputs from other teams as well, from other departments as well, from other professors, lecturers as well. So you get to know a different angle of view. Success comes from passion and perseverance. So we all know the example of Chandrayaan 3. Chandrayaan 2, it failed. It's called as a failure, but it's not failure. It's actually partial failure. The orbital mission was, the lander was, but still ISRO kept on going, and finally they succeeded in the mission. Treat setbacks as learning and as temporary, often leading to better results. Treat failure as an opportunity to pursue new ideas and change. So back to the innovation process, I'll be running through needs funding stage. So we are here at needs funding. Okay, in needs funding, we need to understand who is our customer. First, we need to understand who is your internal customer and list them. So, as a company, our internal customers are our team members or subject matter experts. We are going to present. It's the management, it's the marketing team, production, quality, regulatory, all departments. But as students, you might think who would be your internal customers. So if you're trying to solve a problem for the industry, being a student, your internal customers would be your project guide, would be seniors in your team members, different departments who you are going to present your solution. So select a partner in your team or maybe another team and discuss your list of customers. And you'll be surprised by identifying your internal customers. There could be a lot. So like I said, subject matter experts, marketing, production, quality, these are internal customers. So internal customers are also connected to innovation. So from different points of view, we are able to understand the problem as a whole, and that contributes to it. Then you need to define the strategic focus that you have. So as a company, what is our strategic focus? What is the field that we want to do? What are the kind of products that we want to launch? What problems do we want to solve? What is our business objective? So that is the strategic focus. Keeping the strategic focus in mind, we need to observe problems. Next stage is observation and problem identification. So for that, we need to go into the field. We cannot sit in our office and think of the problem and then try. We have to go into the field. We have to go to the hospitals, into the procedures, into the operating room, and see what is happening. We need to understand the life of the patient, what the patient does with the product. Then comes the next stage, which is need statement development. So we start defining the need statements. So these need statements are referred when we are trying to solve it. Okay, what is the mission of the team? That is what is the strategic focus. What are the areas of growth? What are the business goals? Acceptance criteria is something that is very important. At this stage, we define what is the acceptance criteria. So when we observe different needs, we need to have a set of acceptance criteria to select among those needs, take them forward. Observation and problem identification. So in this stage, we actually go into the field and understand problems, uncover the problems. We have to live in the field and see what is happening, record it, note down, and understand through interaction with the customer. Also understand the needs of the customers. So if I say that the physician or the surgeon is my customer, then the customer who is the patient is also where I need to focus. What happens to the patient when the product is being? Is it causing any trauma to the patient? Is it improving the life of the patient? So after observations, we gather insights. What are insights? These are small notes that we take when we observe, and from these notes, we have identified different problems. For every problem, we define different need statements. So need statements need to be framed in a particular manner. And typically, we have these three key elements in the need statement. So a population, who are the users or the people that are affected when we are addressing a particular need. A problem, so the problem that has been observed through an insight, and outcome. What is it that is desired? The desired outcome has to be in the need statement. So a typical need statement is here a means to display, record, review history of blood pressure measurement of a patient by using a traditional blood pressure monitoring device by the healthcare provider, so that changes in the patient's health can be tracked over time. So this is a very generic need statement. So everyone knows a blood pressure monitoring device called a sphygmomanometer. So the older or the traditional sphygmomanometer comes with a mercury collar, and the physician puts a band on your arm and starts pumping air in it, reads pressure, and as the pressure drops, the reading on the mercury collar observed and noted. So traditionally, readings have been noted on a paper on a patient's card to track the history. So here, what the need statement is that whenever readings are being taken for a particular patient, the patient might want to maintain a history so that in future when we go to a patient again, this history can be referred for the next book of it. So the need here is to display, record, and review history of blood pressure for a particular patient. The population here is not the patient, but it's the healthcare provider or your doctor. So because that is the user of your product, which is going to be a blood pressure monitoring. The problem is, like I said, to display, record, and review. And the desired outcome is that there's a record and changes in the patient health can be tracked over time. That's the desired outcome there. So we have identified multiple needs. We are coming to the needs screening phase. So when we go on in the field, we have identified multiple needs. There can be hundreds of needs. What is it that you should solve first? What would be the priority that you set? So that is what is done in the needs screening phase. So if we take the same need statement, what would be the priority for that need? So we first classify the needs to must and wants. So must is are those kinds of needs that must be solved at any cost. That should be your target. And wants are those needs which are desired, something that can be solved or something that may not be solved or may be solved in the future. So they can be optional, but must are those that we need to solve. Again, good must and wants are elaborations of any part of the population, problem, or outcome. They are objectively defined. They are measurable. They are truly valued. So by truly valued, it means that you can exclude all the superficial defined needs.
They are understanding or they have some they are doing just
Yeah, this might sound monotone because there's a lot of text. And
you can ask anybody has any questions in between.
if anybody has anything to ask, any doubts, any question, is it clear so far?
Or we can ask a question. What, according to you, made Chandrayaan 3 possible or successful? Because this was made at a cost when most of the, the cost was similar to some of the flop movies as well. Any idea, any thought process, what made Chandrayaan 3 successful? I would say innovation. Would you guys agree or not? So how did they, that is what you can connect all the points from the Nachiket's presentation, that what we have to do is to identify the needs. That is very important.
Anyone? Any question, any doubt so far? Very easy to understand, or maybe my got boring, or it's not sleepy, or so. I was talking about the 4 attributes for the need statement. We value that we use as criteria to exclude all the superficial. And solution 3. Now this is very important, and this is something that you really need to understand as an innovator. Solution 3. You are at a stage where you are defining the needs. You are trying to understand the problem, not solve it. So at this stage, most innovators, most people who are trying to solve the problem jump to the conclusion, jump to some solution. They start thinking of directly the solution. So at this stage, we are trying to avoid coming to the solution. The need statement is independent of the solution. We can have solutions in our mind, we can have ideas, but we can note them separately. But the need statement does not have the solution inside. Right. Okay, so this was about identifying the needs. So this was the most important part of my presentation. I would like to again ask whether this was clear or anybody wants me to elaborate on anything. Okay. So once you have identified the needs, once the needs that is green, then you can take up those high priority needs and then come to concept generation. Next slide. So we are at concept generation. So this is a very a generic flow path for concept generation. First, you start with brainstorming on the needs and how will you solve the problem. So you may not get a complete solution. You may get multiple ideas for different needs. You can note them down, you can make mind maps, you can brainstorm it further, you can make sketches, ideate in the same phase, and then come to a design. So generally a design is something which is a combination of multiple ideas that try to make the solution work. After designing, you need to create the design in 3D or in 2D or on paper, and then prototype it, test the prototype, see how it is working, test it in the lab, or you can go and test it in the field. You can get a voice of customers, you can take feedback from your customers, and if it is not working, you can iterate it. You can go back to the brainstorming stage and you can go to the customer again. So that is concept generation. It's a very what do you say? Bird's eye level overview. And most of my presentation was about need spending. Coming to concept selection, we are here, concept selection. Next step. So generally, when we have multiple concepts, what we do is we start with ranking the concept. And to do the ranking, we have the acceptance criteria that we have decided. So acceptance criteria was also for screening the needs. Same acceptance criteria can be used for screening the concept. So this is a typical cosmetics that we use. There can be multiple concepts, and we have different factors that we use to rate the concept, and then we take a total. So to do the rating, we can also involve the end customers. We can involve our internal customers as well as the external customers. And once we get the rating, we decide which concept to be taken. Now these ratings need not be 100% accurate because they can be biased to some extent. But this is just the starting point. So later on, we make a working prototype of this concept and test it out. We do biocompatibility testing and so on. So there's a larger process for this finalize the concept before it is launched in the market. So that was about ideation and needs statement. I would like to conclude my presentation here. Anybody who wants to add anything, ask anything?
Thank you. Thank you, Rajkeet. We have a question and answer section as well. So keep your question part, guys. And thank you, Rajkeet, for a very elaborative ideation process. Now we'll get to the next step of it, which is now you have generated your idea, you have your concept, you have your constructive working idea. Our colleague Madhurima will talk about intellectual property, which is a good part of it. So yeah, Madhurima.
This mic and you can move around. I think you are saying
Am I audible to everyone?
on.
I'm audible just like that. Am I audible?
Yes.
Yeah. So my name is Madhurima. First of all, very good afternoon. Please don't stay. And let's start with something interesting. Forget the slides for some time. So 2 days back, iPhone has launched series, right? Are people aware about that? And we also have Samsung, right? So who supports who? Samsung and iPhone. Phone friends. iPhone users or someone who wants to buy an iPhone.
I don't have a place to support that.
Okay, what about Samsung? Okay, fine. Thanks. Let me share with you a story. So iPhone came up with their iPhone series, and they have their own technologies and designs, right? After a few years, before iPhone launching its product, like Apple launching its product, Samsung came up with Galaxy series, and they launched their products in market. Now, what happened is that Apple realized that Samsung's products, technologies, and the designs are exactly the same or copy of Apple's technology and design. So what they did is that they filed a case against Samsung in the court stating that Samsung has copied their design and technologies and has launched the products in the market. So now what happened? How Apple was able to sue Samsung? So Apple, what they did was they protected their ideas, which are the technologies and the designs. And that's how they were able to stand up. And in 2018, what happened was that it was about it came out that yes, Samsung did copy those technology and designs, and Samsung had to pay a lump sum amount of money to Apple. So, what is the importance of this story? Is that once you have an idea, you need to protect it so that your competitors won't come and copy those ideas and make money on it. This is one story. The second one is we all travel by road, right? On highways. You may see Maggie on highways. And how we recognize Maggie? Any one of you? N. Right. So what is the significance of N? We call it as trademark. M is a trademark. So this is an alphabet which McDonald's has protected, and it gives brand information, or that's what it gives the identity of the brand McDonald's. So it's important also to protect your brand names or logos. So these are all intellectual property. We all own certain property, right? We own land, we own houses, and we never want those land and houses to get captured. Right? We would not want someone else come and capture our land. And we put fences around it, or we have documents around it, legal documents around it to protect our land. Similarly, we need to protect the intellectual property. There are several types of intellectual properties which are So there are these many types of intellectual properties which are copyrights, trade secrets, patents, geographical indications, non-legal rights, and trademarks. All these properties are very important companies like us or any other companies that we have. Out of which there are 4 important intellectual properties which I will talk about today, which are copyright, trade secrets, patents, and trademarks. Right. So, copyright. You all watch YouTube vlogs, right? Are you aware of YouTube vlogs? Can you ever see that nowadays, like the vlogs are not allowed to put songs in video? Right? Why so? Yes, the right of those songs belong to someone else, and the bloggers are not supposed to use the song without the permission. So copyright comes under that area. So there are different types of works which comes under copyright, which are like literary works like stories, novels, your songs, movies. So all this comes under copyright protection. So if you have to protect your creative work, then you need to apply for a copyright registration, and which can be done by directly applying to the Copyright Office in New Delhi. So there's a process which takes place where you need to apply for your copyright registration. The examiner examines the copyright application, and at the end they give you the copyright certificate or registration. So this comes under copyright. So how it is important to us? So we don't make products, right? We market our products. There are websites on which we market or display or publish our products. We have the information about products. All those information gets protected under copyright. So our competitor can't come and copy those information. Even you can't copy those information and paste it in your project without giving us credit. So that's the importance of copyright. Can we move to the next? Trademark. So I was saying about McDonald's, and you can see there are several other trademarks given like Apple, Coca-Cola, and Adidas. So trademark is also very important in order to protect your brand. This actually helps you identify the brand. So it has a simple process where you need to apply your application in the trademark offices in India, and then it goes to examination, and then at the end you get a trademark certificate. Next slide. Trade secrets. We can see here 4 examples of Coca-Cola listed in the mouthwash, Google, and KFC. We all love KFC's fried chicken, right? Do you know the recipe of KFC's fried chicken? No. You can reverse engineer it, but we don't know the recipe. We don't know the recipe of Coca-Cola drink also. We don't know the algorithm that runs behind Google search engine. So these are all secrets kept by the company. So that's how it is termed as trade secret. The company decides whether to publish this information to public or not. And they have decided to keep all this information confidential because that gives them the monopoly in the business. That's how they earn billions of revenue. Here comes patents, a very important intellectual property for all of us here, and especially for the engineers who are developing or might develop new technologies. So patents are a way of getting a right where you try to protect your invention. We all go through research articles, literature, etc., right? But those literatures and everything don't have a legal right. Those are not legal documents. But with patent, the person who comes with that invention, that person gets an exclusive right for 20 years. During this 20 years, you are able to actually use your invention, sell it, make it, manufacture it, whatever you want to do with that invention for 20 years. The government gives you that right. In companies like us, when we develop product, before this section, we had the ideation section, right? Where we generate idea. During those phase, we start also thinking about protecting our ideas through patents. Because if you don't protect our idea, just like what Samsung did to Apple, some other competitors might come and copy our idea and come up with their own products. So this is the reason we need to keep on protecting our ideas, even though we haven't decided to launch those products. And with this patent, you can always sell this patent also. If you have this patent on your name, you can sell it to some other competitor and get royalty or money out of it. So there is a process. The process is that every jurisdiction or every country has their patent office where you can file or apply to get a patent. You need to draft your invention and then you need to file to the patent office, in our case in India. And there are many patent offices throughout the country. You need to file that application. That application gets examined by attorneys and patent agents in the office. And then once that examination is done, you get a patent grant. But that examination is happened on certain criteria. So in order to get a patent, there are certain criteria which needs to get fulfilled. Then only you will receive that patent, where you get that exclusive rights for 20 years. The criteria are that your idea needs to be novel. That is, your idea needs to be new, something new. There shouldn't be something similar out there in public. The second part is that your idea should have an industrial applicability. It shouldn't be just an abstract solution. It should be a concrete solution which is applicable in industry. And the third thing is that idea will not be very obvious. Let's suppose you come up with an idea which any of us can come up with. It should be something non-obvious. After getting all this criteria marked, then you will be able to receive a patent. So the importance of patent is it's giving you an exclusive right to actually earn money out of your invention, and later on maybe you can use that money for further R&D. Do you have any questions here? Okay, let's move. I have a few questions here. Let's see if you are able to answer it or not. Coca-Cola composition is a trade secret, yes or no? Yes or no? Utility, novelty, and non-obviousness are three patentability requirements. Yes or no? Is software or algorithms patentable? No, software and algorithm comes under copyright. You can get a patent on literary, dramatic, musical, or artistic work. Yes or no? Yes or no? Can you protect an idea? You can protect an idea. No, you can't protect an idea because idea is an abstract solution. You need a concrete solution to protect an idea. So that's why you can't protect an idea. You can protect something which is concrete, which the solution needs to be very concrete. Then only you'll be able to protect your idea. Okay. Any more question? I don't think you guys have questions, but I don't want you to sleep also. Any question?
And do next semester.
Thank you guys.
Thank you very much. Thank you. Small exercise patent. So everybody have their smartphone with you, right? Is there anybody who don't have a smartphone? So go to the Google.
Apple का नहीं है.
Okay. Go to Google and search for a patent from Michael Jackson. The first person who gets the patent has to come here and explain what is the patent. Can anybody raise their hand once they find the patent? Got it? Can you explain?
Anti-gravity.
Anti-gravity shoes.
What?
What is that? Can you come and explain? Okay.
Google उतने ही पास है.
So, you know, Michael Jackson is very famous for moonwalk, right? So, he did a stunt a couple of years before where he slanted more than 20 degrees like this without falling. Okay, that's the patent. So, he had a attachment in the floor where he fixed his shoes to that attachment and it enabled him to slant more than 20 degrees. Everybody will fall within 10 degrees itself, but he was able to slant, and that became a patentable. Thank you. What's your name? Sorry? Achintya. Right? Thank you, guys.
Thank you so much. And thank you, Madhurima, for training our young upcoming engineers how to protect their innovation, their constructive ideas. With this, we'll complete this session where we have talked about ideation and intellectual property. And now we'll move to the actual product and the product development. Yeah, I'd like to call upon Kumud Sastry, and he will brief take you through new production development process. Yeah, over to you, Kumud.
Thank you. Hello.
Hello. Hello. आप लोग सो तो नहीं गए यार? पक्का? Good afternoon, guys. Good afternoon, guys. अभी भी आवाज नहीं आ रहा, मुझे लग रहा है आप लोग सो गए. Good afternoon, guys. खाना नहीं खाया किसी. Good afternoon, guys. तो फिर ठीक है, स्लाइड ही देख लो आप लोग पर. So actually, see what we are doing in Boston Scientific. We are developing a product for the patient. Patient is an end user, and we are giving our product to users like the doctors. So doctors is our end customer, just mentioned by Yogesh in the introduction. So it is very important to know that like it is new product development or the product development, it is the same. So new product, if it is not in the market, we are going to say it is new product. If we are adding some values to those, it is improvement in that product. So we can start with our presentation slide. So objective is very clear, like provide a high level understanding about the process of developing an idea or product. Similarly, the various aspects of the challenges we are facing in developing the new product development. So, guys, as you know that we are in medical device development product, so there are some more criticality because it is a life straightening. So if okay, just example. So do you know any difference in the engineer and a doctor, or a mechanic and a doctor? हाँ कोई भी बता दो जल्दी से भाई. मैकेनिकल चलो ठीक है, कार मैकेनिक समझ लो, कार मैकेनिक and a doctor. Can you guess what is the difference? Huh? You guys are in third year, right? Anyone who is in no, who are not in third year or some like all are engineer, right? Mechanical, electronic, electrical, यही लोग हैं ना यहाँ पे. कौन से कोई नहीं है बकता ना, मशीन समझते हैं सब लोग, राइट? तो सिंपल क्वेश्चन है, मैकेनिक और डॉक्टर में क्या फर्क? दोनों कुछ ना कुछ सुधारते हैं. सिंपल सा फर्क है. Doctor who is working directly when the patient is bleeding, right? He's living lives. Like he's just experimenting or he's just treating those guys. But the mechanic, जो बंद पड़ा हुआ है उसको सही करते हैं. So this is simple example I just wanted to discuss with you. And new product development is the same. Here we are having some simple things. What the new product development? Bringing a new product for the market, bringing the existing product, introducing a product for the new market. So this is simple. We can say. So what is the main important thing is the product design. So when we are going to say the new product development, the design is the core central part of this thing. So we are having a product life cycle. So how it is going to start to end. So anything which is developing, we have the user need, everything just explained by the okay. So we have something more. How we are going to develop a product and what are the product life cycle? You can start with the. So if we want to develop a product, we need to have a higher decision from the management who are running the company. So they need to say that this product is required for the market and it is a need for the market. So there are two options. Either we can develop a product or we can acquire a product. So we are in the both the directions. If there is a technology which is already in the market, and if we can buy that technology, it is very good. If we can't buy, and management is suggesting that we need to develop it. So the other options. When we are going to develop, there are some more processes. So starting with the explorations, where we are just going to search, identify there is a need or some explorations in the technology. We have a develop technologies process. We are saying a technology development process, TDP. Then we are going to develop a product. If there is no technology, we are developing that technology. Then once it is developed, we are going to design that product. So we are going to develop it. Then there is a sustaining. If that technology or the product is already in the market, we are going to say whether it is sustainable or not. So we are going to provide all the what we can say. If suppose there is a change in some international standards, we are going to make our device to be compatible for that standard. So we are going to do this in sustaining and then end of the life. So in medical device, you need to keep you cannot run the product whole life. There is some ending of this. There is expiry date. We need to keep a record of those end of life. So this is the last phase of development. This is basically a model how we are going to proceed further. This is the NPD cycle we are saying in the medical device. It is FDA approved.
So we can start with the user need, then design input, then design process, design output, medical device design. So once we are meeting the design output with the design input, we are saying it is verified, right? So we need to verify this before going to the next step, developing a medical device. Once it is developed, we are going to validate that device, whether it is meeting the user need, user expectations, whether whatever we have earlier, we are going to do it or not with this device. So very important, every phase we need to review it. So design review is the process in between doing the next step. So I'm not going to recap this because this is already explained by Nachiket, the user need. So do not go to the solutions, first understand the problem. So this is the user need. So user need is, you can see the interaction with the doctor, immersions. So there is some clinical procedure in the hospital. So we are going to go along with the doctors and we are going to check whether this is actually a requirement or how we can support or we can help in this problem, whatever you are facing in the clinical immersion. And some of the research or the survey. So these are the three things which is helpful for the identifying the needs. Next. So yeah, this is we discussed. We can skip. Okay. Go. Next. So there are some categories for the user need. We can say voice of customer, voice of regulation, voice of technology, voice of business, and voice of value. So these are the things which we need to maintain for user need. Okay, so designing a product. So we have a user need. Now, how we are going to develop a product? So we need to understand with the user design input. So design input in terms of like whenever we are saying design input, so user need is comes from the doctor or who are not the engineers. But when we are going to develop a product, so we need the engineers to get this work done. So for engineers, we need to instruct in an engineering language. So this is what we are trying to do. We are just creating a engineering requirement for them. Like we need to have a weight of, like suppose we are using a shoe. So we say that it should not be very heavy. So how much heavy? So we can say it is less than 400 grams or something. So 400 grams, this is we are going to turn into user need to the design requirement. This is how we are doing here. So benchmarking like there are competitors who are doing the same, who are just creating the same product in the market. We need to understand whatever they are just providing in the market and can we have some more values, additional values to that product which is already in the market. Some just R&D, literature R&D, then we are just transition those user need to the design requirement. So this is design input for your product. So this is well documented and very important, very critical for the medical device. So everything is based on this document. You can see. Next. So design process, like we have the design requirement, then we have like Nachiket suggested, like how we are going to do it, like brainstorming, demand trace, fit and gap analysis, design thinking. These are the things which we are going to develop before going to the design delivering the product. So some testing, when we have a brainstorming, we have some concept, we are developing this idea, bench testing, some engineering principle and calculations, and once this design is ready, we are going to check it on the simulations. So this is actually the design process when we are going to create a product. In between, whether I am going little fast or you have anything, guys. All good. So design output. So when we have design input, then we have design process, then there is some design output, like what are the drawings. If we are going to manufacture it and we need to provide those input to the other manufacturer, so there must be some inputs there, like what are those things. This is design output for them, like engineering drawings, assembly instructions, circuit diagrams, codes, and sometimes we are saying the IFU instruction for you, how they are going to use it in the field, or how they need to use it on product. So these are the design outputs. Whereas I told you earlier in the diagram that when we are going to meet the design output with the design input, we are verifying those things. We need to verify it. Once it is verified, then we are going to develop the product in the medical device. Next. So validation, there is little bit difference in the verification and the validation. Verification is we are going to match our design output with the input. And once we are going to develop a product, that product needs to be matched with the user need, what the customer, like the patient, whether it is delivering exactly the same what is required for the patient. If it is done, then we are saying it is a validated product. Next. Okay, so once that product is developed, we are going to launch into the market. But before launching, we need to understand that whether it is approved by the regulatory body, because this is not the case like we are going to develop this product in India and we are going to sell it in India. If it is selling, we are selling it to the other countries, we need to follow all the instructions, all the regulatory body, whatever they are doing in the US. So they have the FDA. In India, it is different. You can see HC, FDA, ANVISA, CDSCO. So these are the different regulatory bodies in different countries. Yeah. Anything next? I'm done with my presentation. Okay, thank you.
Thank you. As suggested, now we'll have a test. Right? You guys are ready? Based on the Kumud's presentation. Everybody is ready for the test? Come on, guys. Are you ready? Yes. I was just joking. Come on, there is no test. Now, it was all theory session. Now, I would like to call upon Sunil. He'll take you through some of the products which has gone through this process of design input, design output, design verification and validation. So it's time for a demo session where Sunil, our colleague, he will show you some of the products which has been developed in-house at Boston Scientific. Yep. Over to you.
Good afternoon. So, as we discussed right now about overall product, irrespective of the organization, you have any kind of an organization or any type of organization, new product development process remains same. Fundamentally, it remains same. There are certain aspects which needs to follow in the medical device. Right? So today, Today I am going to present one of the case which is developed by us, that is called as a irregular stent. Right? So before we enter into that, let me ask one question. Do we know the kidney? What is the function of kidney? Somebody is saying that drinking water is the use of kidney. I think that Sunil is saying drinking water is the use of our kidney. Is that correct? What is the function of kidney? Right, filtering the blood, remove waste, and regulate the rest of the bodily fluid. Let me ask second question. How many of you have a kidney? Let's raise your hand. I think there are some fellow which might be came from the different land, they don't have kidney. Right? Okay. Next question. How many kidney do we have? At least you can raise your hand with the fingers. And someone is saying 1 kidney, right? Acha, ek base diya, right? Okay, so everyone have 2 kidneys, right? Okay, we'll say that let's start about the case study that is ureter stent, and ureter stent is the device used in the urinary tract. So we'll talk more about what is the urinary tract. Everyone have a urinary tract system, right? So I don't want to show you the device at this stage. Otherwise, you will say, okay, we did all this circus, and then you will find the device which doesn't make any sense. Why we did lot of circus? That's the beauty of the medical device. We'll say that. Let's go to the next one. Yeah, see, this is a flexible tube for having the pigtail at both ends. Right? So let's see, she is saying that it's really product. Right? It's a very simple product. Simple plastic tube having a pigtail at both ends. But it's play a very important role in our life. Right? So almost, I would say most of the people above 40 have gone through the kind of kidney stones. Right? That is the treatment or the medical disease where this device is being used. We say that the problem statement for this one is to develop a device who can drain the urine from kidney to bladder. That's the problem statement. Let's move to the next slide. Next. Okay, so before entering into the new product development for medical device industry, like you, I'm also not familiar with the anatomy, disease state, and what are the treatments available before I enter into the medical device. Right? No one learns in the engineering graduation, okay, what is the anatomy, right? What is the function of kidney? What is the urinary tract? So, in order to develop the product, first we need to understand the anatomy. We need to understand the disease state and the treatment where this device is going to be used. Right? नहीं तो हम मेडिकल डिवाइस डिजाइन करने के लिए चले गए और हमने डिजाइन किया फ्रिज ऐसा नहीं होना चाहिए राइट सो वी नीड टू अंडरस्टैंड वी नीड टू एंटर इनटू देयर फील्ड वी नीड टू एंटर इनटू क्लिनिकल एंड फिजिशियंस फील्ड वी नीड टू अंडरस्टैंड देयर रिक्वायरमेंट्स राइट वी से दैट सो let's move to the next slide. This is a urinary tract system. Every one of us having this urinary tract system, right? If anyone having only one, that might be very rich person, might be donated to someone else, right? So anyone not having any of this kidney, they might become from the different type, right? So we need to understand where our device is going to be used. Right? It starts with the kidney, right? The function of kidney to filter the blood, remove the waste, and regulate the rest of the body fluid. Right? So urine get transferred from kidney to your ureter via ureteric pelvic junction. Right? And then through ureter it goes into the bladder. Bladder is a reservoir where it stores the urine. As soon as it reaches its desired capacity, it gives signal, get lost. Right? So that's the urinary tract system, and then the urine is drained from your ureter. Now, this is the overall urinary tract system. We understood that, okay, my device is going to be used in this particular urinary tract system. Let's move to the next slide. What are the different medical indications, right? What are the different diseases where our device is going to be used? So these are the medical device indications, right? Urinary cancer in the urinary system, then ureter trauma, and the intrinsic compression. Right, so let's understand about the cancer in urinary system. If there is a cancer in urinary system, the urine flow gets impacted. Right? Same way in the trauma. Trauma is nothing but हम किसी के कान के नीचे लगा देते हैं ना, तो कैसा लगता है? It looks like hard, right? There is some injury. So trauma is nothing but the one kind of injury. If you try to take some pin and put it in your body, right, you will feel some trauma. That's a trauma which can be result into the injury. The second thing is about the compression, right? Around the urinary tract system, there are multiple body parts, right? So compression is nothing but एक body part दूसरे को push कर रहा है. That's abnormality. And because of that, the ureter is a very flexible muscle which can get compressed. So because of that, all these three urine flow get compromised. Right? So in the second image is a picture where you can see in the image the narrow down of the urinary tract. Right? So it means that I don't know whether here anybody is from the mechanical engineering, but for flow, diameter of pipe is very important, right? If your diameter get smaller, you will not be able to have that much flow. So that's the medical indication. And third one is the stone. Right? Stone is a natural process where the stone can get from your body because of multiple reasons. Because of some of the reason like multiple medicine we are taking, right? Nowadays, थोड़ा भी सर दर्द हो गया है ना, तो मम्मी बोलती है ये medicine ले लो, right? Because nowadays we don't have that much patience, right? So having a more medicine can also cause the stone formation. So we say that in the stone, we have a lot of stones, and you see the image. These are the particular location of the tract where you can see the stone can get accumulated. And now, what will happen if we not resolve this problem? The urine will start accumulating in the urinary tract system. It can back to your kidney, and then it can start damaging or impacting your kidney. So early is the better, right? So हमें इसको जल्दी से जल्दी बाहर निकालना. So that's the medical indication which we have to treat. Let's move to the next slide. On the stone, there are multiple clinical procedures are available. So before we enter into the new product development as an R&D engineer, we need to understand, okay, what are the different clinical procedures available to treat these medical indications. Right? So the first, it depends on the size and location of the stone. The physician determine which of the procedure they need to follow. So it starts with shockwave lithotripsy, which is a kind of very simple procedure where patient might be lie on the bed of the machine and shockwave is thrown over the patient and that will break the stone and patient can go to the. The second thing is like the URS or RIS procedure, right? So it's very boring. It might be boring for you, but just let's understand one thing, right? So if any stone present in your ureter, in the middle of the ureter, physician prefer to go for the URS procedure. If stone present into the kidney, which is a very topmost portion of the urinary tract system, the physician prefers to go for the RIS procedure. That's the difference between these two. And the third one is a surgical procedure called as a PCNF, where the patient might be insert in the patient body. Physician might insert in the patient body and take the external access to treat the patient. We'll say that let's see one of the video of URS or RIS so that you can compare and understand what is the procedure. I hope okay. Fine. Thank you, Kumar. आवाज नहीं आ रहा है ना? Okay, that's fine. I will explain you. That's kidney, ureter, bladder, urethra. So that's the main organ of the urinary tract system. You see there was a stone, right? So physician first use the scope to see where is the bladder hole and where we can get the access to the urinary tract system. They took the access, right? So physician ideally first inject the contrast and see the image where is the kidney, stone is located. Now they understand where is the stone. This is the X-ray image. Now they start the procedure. They insert the guide wire over there. Now they insert the flexible scope through which they will insert the laser. Right from the laser, they inject the energy and they break the stone. And if stone is smaller in size, they will immediately withdraw with the help of retrieval basket. Now basket is coming out of the scope, holding those stone and taking them out. जब लैंडस्लाइडिंग होता है ना, कभी आप जाते हैं क्या पानी घाट से ट्रेन बाइक पे, तो लैंडस्लाइडिंग होता है ना, तो they are just taking them out. So that's what the retrieval basket is doing. Now they are checking, जैसे पुलिस आते हैं और चेक करते हैं ना, कोई बचा तो नहीं ना पीछे, जब शाम होती है. Now that is done, now that's the entire process is done. Now they will insert the device which is supposed to be designed. Let's move to the next. So these are the steps. Okay. So in these particular urological procedures, there are 4 steps. Right? If हमें भी अगर यहाँ से मुंबई जाना है, तो first we have to go to the toll, Talegaon toll, right? And then from there we have to go to the Lonavala and likewise, there are steps in the procedure. First is the access. Get the access where we have to go. Right? The second is the dilation. जैसे मैं बोला ना, simple language, landsliding होता है, तो खाली 2-wheeler ही जा सकती है. Right? तो क्या करना पड़ता है? वो निकालना पड़ता है, so that 4-wheeler can go by that road. So dilation is the same thing. There is something happened because of that the river is not able to cross that path. So dilation is used. And then finally lithotripsy. And the retrieval, once we broke the stone, they have to take it out. And finally the drainage. Right? So the step 4 is important where our device is going to be used. Let's move to the next slide. Right. So as Kumul explained earlier, so new product development. Actually now new product development starts. Right? So in the user net, there are 2 aspects, use specification and user net. So in the medical devices, that is a difference. So we have to capture the use specification. We need to understand now if you see all the videos and then our disease state and the treatment. So based on that, we are able to understand how the device is going to the urinary tract system, right? So who are going to be used that device? Who is the end user? So that information is very important for the use specification, which needs to be documented. एक एग्जांपल होता है ना कि हमारे कि कोई ऐसा है कि किसी का घर है जिसको कोई फाउंडेशन ही नहीं खाली बना हुआ है. Do you have any house without a foundation? तो पीछे के कॉर्नर में बोल रहे हैं उसका घर वैसा ही जाए. Right? So foundation is very important. So that's use specification very important. हमें हाईवे से जाना है तमिल का या बीच के रास्ते से जाना है. No, only the highway. So that's a part of the use specification. Let's move to the next. So it is a part of the user need next. So use specification is very important because unless you identify where you are to enter, it's very difficult to design. So in the use specification, you need to understand what is the indication. You need to understand who are our intended patient population, right? So whether children, kids, adults, a college category, we need to understand those things. Right? So that's the intended patient population. With having all this information together, we can proceed to the next step, that is a user need. Just move to the next slide. Let's see one of the example how use specification can be documented. Insertion method, right? So cystoscopic percutaneous introduction over a guide wire. Forget about this two part, which is very challenging, like me as well. So if you have to insert the device in the body, it has to be go through the natural orifice over the guide wire, right? So that's the insertion method of this device. Let's move to the next slide. Once you know the use specification, you have to actually create the user need. So as I mentioned, the user need, it has 2 sections, use specification and the user need. So all this use specification, you have to determine the user need, right? ऐसे नहीं होना चाहिए कि मैंने तो बाइक डिजाइन करना था लेकिन कार ही नहीं है. ऐसा नहीं होना चाहिए. That's the reason foundation is very important, right? So we say that so user need. These are the kind of a few examples of the user need. Take an example like like automatic placement. Can you imagine कि कोई foreign device में body के अंदर जा रहा है, कितना pain करता है, right? कितना pain करता है. So that's the automatic placement of the device. We have to take care about the patient and design the device in such a way that it should create as much as possible no trauma, or it should not create a trauma for the patient, right? So we said that. So these are the few of the examples how we should document the user need. Let's move to the next. Let's see how user need is being created for one of the feature. Compatibility with ancillary devices. So in the clinical field or in the operation theater, there are multiple devices, right? So अगर हमें यहाँ से बॉम्बे जाना है, there are multiple things. We can go by two-wheeler, we can go by the car, we can also take a flight. कोई बोलता है मैं पैदल ही जाऊँगा, अभी तो साइकिल का है. Everyone would like to use a cycle, right? So there are multiple ways, but based on that we need to identify what are the different the devices is being used to treat this particular patient and what are the different devices used for the particular treatment. So there are multiple devices. If you have seen in the routine, there are X-ray machine, there are guide wires, there are injectors. So we need to see the compatibility of our device with respect to that. So see one of the user need, right? So I know that everyone might be having their two-wheeler, right? कोई ऐसा है जिसके पास two-wheeler नहीं है, वो कॉर्नर में लगता है जिसके पास two-wheeler नहीं है. Hello guys, anybody don't have a two-wheeler? नहीं, सबके पास है, right? So जब two-wheeler ले रहे थे आप लोग, so what will be the first question, right? अगर मैं होता तो मेरा पहला क्वेश्चन होता, I need a two-wheeler for doing the critical moments, right? So that's how the user is asking about. ऐसा कभी हुआ है कोई गया है और बोला है कि नहीं मुझे ऐसी बाइक चाहिए जिसका माइलेज 80 km/h. I don't think so. So that's the user need. It's the performance expectation of the user in the clinical car, right? So based on that, guidewire is one of the ancillary devices used for the treatment. So we have to determine write down the user need, like our device must be compatible with that. So moving to the next, that's the user need. Okay, so before we enter in the design requirement, now I have a question for you, right? So I will give you an example. Just tell me whether it is user need or design requirement, right? I want a car to having a weight of, let's say, 100 kg weight, right? Is it a user need or design requirement? Can you tell me? If I want to buy a car, if I say I want a car which having a weight less than 100 kg, is it a user need or design requirement? Okay, I don't want to bore you guys. So it's a design requirement. Design requirement is nothing but the engineering term where we can determine we can review and verify those requirements. Whereas the user need is I need a car of a diet weight. That's the user need, right? So moving to next, let's move to the design requirement and see how we translate the user, how we need to translate the user need into design requirement. Let's move to the next. Move to the next. Yeah, so all those in the blue, you can see the user need, and based on the user need, we have to convert as a design requirement. Let's see one of the example how we should convert the user need to design requirement. Next. As you know that based on the guideline specification, we determine the user need that user device should be compatible with the user need. Now, in order to develop the design requirement, we need to go through the publications, literature review, clinical scenario, meet with the physician, and understand what are the different guidelines being used in the particular patient. And based on that, we can determine what size of guideline is used for that. Now we understand that we create a design requirement that device should be compatible with 5.25 each guideline. Right, so that's how user get translated in the design requirement. Let's move to the next. So this is where up to this is very important aspect as we generally call as the foundation of the any building, right? If you don't capture your need and requirement properly, right? So अगर जैसे मैं बोलता हूँ ना कि हमने two-wheeler design करना था, लेकिन end में हम four-wheeler पे लगे. So it is very important to have a successful ability to document the design input. Right, so then once we have the design input ready, we need to design the product. Move to the next. So design requirement, so we wanted to design, there are multiple ways, theory, then we have competitor study, bench testing, we have engineering principle, जो भी हम book में पढ़ते हैं, those principles is going to be utilized while designing the product. Let's see some of the examples. Move to the next. If you have to pass our guide into the device, right? So the clearance fit is very important. Based on the calculation, we can determine how much clearance is required. Let's move on. This is the inner diameter of the drainage. As I said, based on the diameter of the pipe, we can determine how much flow we can achieve. Move to the next. Then tensile. I think at least in first or second level might be done this thing. Tensile strength. Right? So material and the thickness of the pipe is play a role. So that's your design. So once you have that principal calculation done, you can design the device. Let's move to the next competitor study. मेरे सामने एक लेबल है जिससे I can understand the word guide I need to be used. Right? So that's the competitor study. Once that you have a design ready, now you have to create the design outputs. Right? So let's move to the next. So design outputs. For every design requirement, you have a design outputs. Right? Design output is very important because that will make sure that you have to make the right design and that design is going to be verified with respect to the requirement. As well as if you don't have proper design output, हमें कितना भी अच्छा product बनाएंगे, लेकिन पूरा design output is सही नहीं, no one can manufacture it. You might have a really excellent idea, very good innovation, but if it is not manufacturable, there is no point. So design output is very important. Aspect of the product development. Let's see few of the example how you can create the design outputs. Taper length, right? So that's the atraumatic placement. Move to the next. The marker band is thickness and the width. Next. The diameter and number of coils, right? So that's that will determine whether your device is migrate or not. Next. Thickness is again very important for the tensile one. Next. Let's move to the next. And now we have a design output. Now हमें देखना है कि हमने जो भी plan किया था, whether we are able to make those requirements. Okay, so that's the design verification. Let's move to the next. So if for the design verification, we can do anyway, right? So bench testing, we can do the document review. We can also perform some clinical testing. Okay, so let's see a few examples. Visual instruction, very simple. हम अगर किसी भी गोल्ड स्टोर में चले गए ना, पुराने गोल्ड स्टोर में, तो कैसे देखते थे कि ओरिजिनल है या डुप्लीकेट है, right? So that's the visual inspection. It is also being used for verification. Length measurement, simple steel rule है, you have to take it and measure whether you are meeting the design requirement of the. Let's move to the next. Simulated testing, we have to create or duplicate testing anatomy, which is the reference for tensile testing, simple. ऐसे पकड़ लो और खींचो and see whether when you meet it and see whether it is meeting your design requirement. And then once you have the design verification passed, you have a critical device ready to use. Let's move to the next. Now this is a final product design which I will the next. These are particular features. Keep moving. Next. Right, so that's the entire critical device design. Let's move to the next slide. Now design validation, right? So as we learned earlier, what is the validation? We have to take that device to the user and see whether we are able to make the user need. ऐसा नहीं है किसी ने हमें बोला है कि मुझे 40 किलोमीटर पर आवर बाइक चाहिए, हम उसको ऑलरेडी दे रहे हैं. Right, so that's the validation process. It has to be validated in the clinical setting. And if you see, these are some of the user needs to be validated for the clinical setting. You can take the device to the physician and ask them whether it is compatible with the diagram. So that's how the design validation differs from the design verification. Next slide. Okay, so now you pass the design validation, how your product is ready to go with our market post the approval. Right, so we can skip this video. So that's the irrigator stent devices in place in the body. If you see the two images, stenting post procedure In the left side, you can see the how device is been placed inside the body. On the right side, you can see X-ray image of the device. Okay, so next. If you have any question, you can ask me. But as I mentioned, I will tell you at the end of the case study that device. See, this is a very simple device. Might be last page, might be not able to see it, but it needs to go through entire process, needs to follow all the rules and regulations so that this device can go to the physician with the intended purpose. Yes, so that's all about. Thank you.
Hello. What will everyone? How's the George? I think everybody is eager to go home. Is it? Okay, we are almost towards the end of our presentation. We won't be taking much time. I'm Monica from Boston Scientific. So next will be, as you can see in the presentation, the word brain is something that comes up. So we'll be taking you next towards one of the most hysterical human organ that is still under research, brain. We'll see the problem statement, we'll see the solution that we have designed around it that's available in the market. So these are the few topics that we'll be covering. Human brain anatomy, the movement disorders that arise due to non-functioning of the brain, deep brain stimulation, a new term to each and every one of you. The target areas in deep brain stimulation, Virtualized system and neural navigator, that is a solution, the Boston Scientific answer to deep brain simulation. A product demo, we have recorded a video of the software that we have designed around it. And last, a patient testimonial video that will make you understand what our solution is and how is it impacting the lives of the patients around the world. Human brain anatomy. So as you can see here, the brain, the mystery, you can see in the image there are four main parts of the brain: cerebrum, cerebellum, diencephalon, and brainstem. As it's already, you can read on the slide what are the functions of the various parts of each and every part of the brain. Let's not go into the detail of it, but just for an understanding and overview of it, we have added here. Next. So here, the purpose of this slide is to make you understand. I guess each and every one of you already knows that the left side of the brain controls the right side of the body, and the right side of the brain controls the left side of the body. Why this is important? Because when we are giving our therapy to the patient, we need to take care on which side of the brain we need to provide the therapy so that the patient is able to control the other side. Next. Dopamine, a chemical messenger. Most of you guys put on Instagram, the status dopamine detox, these words we use. Dopamine is a chemical that is generated inside our brain, which has multiple functions. This is still under research. It makes us feel good. It helps us in our movement. So dopamine is one of those chemicals that are generated in our brain. So in case of what happens in few of the patients, the nervous system, the nervous cells who generate the dopamine, here there's a word prematurely. They die prematurely, because of which the concentration of dopamine in the body reduces. That leads to us the problem that human body faces. Movement disorder. As you can see, the stimuli word all of you might know, right? Brain is connected to the backbone through the nervous system. The nervous cells, they generate from the brain, the stimuli that is generated. That is how I'm able to move my hand, move my leg, speak. Everything is controlled by brain. So in the absence of dopamine correct concentration in the brain, it leads to movement disorders. We have medicines available around like levodopa in the market, which actually provide a temporary solution to it. Next. What are the movement disorders? Here I have given you images of 3 separate movement disorders. First is Parkinson's disease. Has anybody heard this disease, Parkinson's? Yes? Okay, can anybody tell me what is Parkinson in just one line, one statement? Sorry? Vibration. Okay, yeah, you are close to it, vibration. Parkinson's initially, as per the study, it was revealed that it is something that occurs in old age patients, but with the recent findings, we have also seen happening among, kids or middle-aged persons also we have detected with the Parkinson's syndrome. So what is Parkinson's? You would have seen in multiple people that their hands or legs, they shake, they are unable to give the way I'm speaking fluently, they are unable to speak fluently. So all these things, disorders, they arise because of Parkinson's disease. That is because of the abnormal functioning of the brain and the nervous cell. Second, the essential tremor. You can read here involuntary. So you would have seen many people when they talk, they have involuntary movement of hands and legs. That is what is essential tremor. Again, happens because of abnormal functioning of brain. Last is dystonia. As the image itself suggests, there are few patients in which we see that they are not able to walk properly, they drag their legs. There's the involuntary pulling of neck. They find difficulty in speech, uncontrollable blinking. These are some of the things that we see in a patient with dystonia. So these are the 3 movement disorders related to brain that I have added. Welcome, sir. Okay. Next, let's come to the word deep brain stimulation. Deep brain stimulation. What is stimulation? Everybody of us have heard about stimuli, right? A response that is generated by the brain. Deep brain stimulation is a therapy that we provide to the patients who have the diseases which we can see in the 3 diseases that we saw in the last slide. The answer to the therapy with permanent solution is deep brain stimulation. What is deep brain stimulation? As in the image you can see, all of us, everybody has heard pacemakers? We all know pacemakers, right? When the heart generates irregular rhythms, pacemaker is the answer to it, which is implanted inside the heart. So deep brain stimulation is similar to pacemaker, but this, on the other hand, controls the brain or helps the brain in normal functioning. 3 major parts in deep brain stimulation is one, the implantable pacemaker that generates the stimuli. So with as the nerve cells die, they are not able to send the signals to the body like hands and legs, because of which they are not able to move it properly. So what our system does, this pacemaker generates those waves to the patient's brain through an implanted wire, and then that brain sends that signals to the body, and then the patients are able to continue their normal day-to-day life. 3 major parts: the pacemaker, the implantable pulse generator, we call it because it generates the pulse, the implanted wire, there's an electric lead that comes into picture. Since we are generating waves of current, very minute in milliampere range, that's why the concept of leads come into picture, the electrode and cathode part. That is how, the current travels from the pacemaker to the brain, and then it's depart to the whole body part. So deep brain stimulation, the electrical signals, and this, obviously, as you can see, it is a surgical option. The pacemaker is placed near the chest of the patient, and then the electrode is placed in the brain after drilling through the skull. Next, please. Yes, the implantable pulse generator, the lead that I was talking about, and the extension that is connected. Now the lead, as I told you, the concept of cathode and anode come into picture because we are sending the pulse waves. So in the market, we have Boston Scientific specific leads that are available that helps, because on the basis of the condition of the patient, we provide them the therapy, and hence we have various leads that are available in the market as per the patient's. Next. So this was the problem statement that we identified, a solution, deep brain stimulation to it, and Next we'll be seeing a video on how the DBS works. A real life example that what the patient faces and what our solution helps them. So there's no video, but I think you'll be able to relate it through the video. The patient is unable to write, has frequent tremors. The solution is an implantable pulse generator. We are trying to give you the battery life. The generators actually are available in various types we have for how long it works in the patient, rechargeable and non-rechargeable options. That will be covered by my colleague in coming slides. See, this is a collar that patient wears when he has to charge the stimulator that we have in the market. Our product is CE mark. Now the patient is able to write, walk, speak, hold things in his hands correctly. Anybody has any questions? Okay, so that's it from my side. Now I would like to call Bhavna to continue with the session.
Hello everyone, am I audible? So, Monica has explained what is the DBS system. Now I'm going to explain our actual product which we are using Boston Scientific. So we have this device ecosystem where we are using different types of leads based on the properties of those leads. And based on the need of the patient, we are using different types of leads. So you can see the daily device. We are using daily devices. All of these are daily supported. So we have primary cell and two kinds of devices. You can recharge, and primary cell you cannot recharge. So like we have three categories with this primary cell. Versailles Genus is the name of that lead in the market, and Versailles Genus P16 and Versailles Genus P32. And then rechargeable, we have two varieties in the rechargeable LPGs, which is Versailles Genus R16 and Versailles Genus R32. And we have external trial stimulator also, which is really supported BTS. And then we have 16 contact directional lead support, which is a 3D kind of leads, which helps us to get the optimal therapy. So two types of leads are there, Cartesia and Cartesia HX. So, for the rechargeable lifetime of the rechargeable devices is more compared to primary cell. So, rechargeable devices last for minimum 25 years life of the battery of the rechargeable devices, and primary cell it is having around 5 years of the life. So, if you can see in the picture also, this device, rechargeable device, one is it's small in size as compared to our primary cell. Based on the patient need, these devices are used in the market. And another thing we are using is Surface Pro 6, which is a 6 tablet with Windows 10. This is used by our clinician programmers, basically neurosurgeon. They are using this Surface Pro 6 to program the therapy inside this implantable IPG. So coming to target areas of the DBS in the brain. So, which area in the brain we are going to target, you have to decide that. That is based on research we are deciding for which disease we are going to target which area of the brain. which side of the brain, which area of the brain we are deciding based on the therapy we need to give the patient. So basically, three targets here mentioned: subthalamic nucleus, so which is very commonly used for target for Parkinson's disease. So it is effective for tremors, motor, rigidity, dystonia, and etc. So next one is GPI, global internal segment, which is also used as a target for dystonia and also for Parkinson's disease, and effective for tremors, motor, rigidity. And third one is ventral intermediate nucleus, which is present within the thalamus, and it is effective for tremor treatment, and it is often used as a target for tremor disease. Next. Coming to product overview. Okay. So there are two categories of the components. The components which is used internally, which is used inside the patient. Actually, we are using these components, and external components which we are using from outside to program the therapy. So we are using DBS lead as mentioned by Monica, that leads. The leads are inserted inside the brain. This is the lead. And hole cover, it is used to cover that wherever that hole is, we are making a hole, it is used to cover that area where we are going to implant the lead. And then pulse generator, which generates the pulse, and it is implanted below the chest of the patient, and it gives the signal to the brain through a wire connected to the lead. This here. And the external system components we are using clinician programmer, which is the Surface Pro, Windows 10, and it is used by clinician or neurosurgeon to program the therapy. And then patient remote, we have patient remote, which is given to the patient. They can control their therapy. They can on the therapy. They can switch off the therapy. Those kind of things we are giving the patient remote also. And the third one is charging system. So this charging system is needs for rechargeable devices which they can charge like it takes around 2 to 3 days. The charging lasts 2 to 3 days, and after that we can charge. Within 30 minutes they can charge the device, and after that they can use it. Next slide, please. Okay, so here you can see how it works. I showed you. This is the clinician programmer Surface Pro tablet, which is used by neurosurgeon or clinician to program how it talks to IPG through PLA communication. It is talking to this IPG to program the therapy, whatever problem is with patient, they can program it, and then this is connected with this RC which patient holds this RC to control the therapy. This is also connected to PLA support, and then this is the charging point. This IPG they can charge using this charging point. It's a simple charging point. They can head in their neck and they can charge it. This works with magnetic charging point. This is known as magnetic charging point. And this is the remote control I have. Next. So this is our software. Actually, this is the software part we are showing here. So different features in the software which we develop. So different features, as you can see in this first screen, we are trying to connect the device. How we are connecting that device, the IPG, how we are connecting. We have implemented that feature, and then after that, once the device is connected, doctor or surgeon need to select the required lead for that patient in the brain. So this second screen, this is showing like how they are selecting the leads, different types of leads, and then they can program it using parameters, pulse width, rate, and everything. They can increase, decrease, and see the impact on the patient, how patient is behaving. They can note down the clinical effect points also, how whether it is effective or it is giving some harm. Those kind of things also they can note. They can make a note of that. Here it is known as therapeutic benefit. They can note down the benefits and if there is any harm, uneasiness or else, they can put down that also. And they can visualize it in the this UI. They can visualize the lead and this anatomical picture they can see here in this screen. And same thing, this and last one they can take the report also. Like they can extract the report, they can read and extract the report. So this report they can use it next time the patient is coming, they can check the history, last time what they did, and based on that they can proceed with the next for their particular mission. Please. Okay, this is one demo. Oh, thank you. So this is the RC which I was showing. This we are giving to the patient to control the therapy. And this is our IPG, which is implanted in near the chest of the patient. This device we are stimulating through this device only. This device is stimulating to the brain. And there are two types of devices. We are showing two devices here. One is rechargeable, one is primary cell. And this is a charging coil to charge the rechargeable devices. They can charge it. And this was the Surface Pro 6, which I have here also. If anybody wants to see the devices or Surface Pro 6 or even the application which we are using, if anybody wants to see the demo, real demo, we can show that also. So there is one video for that. You can see this video. If you want to see actual software here, you can come and see. So yeah, I will explain, since audio is not there, so I will explain this also. So here we are connecting the devices. Device is connected. Now we are configuring the lead. So doctor will configure the lead. We have Boston Scientific leads here. Standard leads and directional leads. Directional leads basically 3D type of lead. They can select the pores and hemisphere of the body, like left hemisphere, right hemisphere, and the target area for that particular hemisphere. They can select like what is the target area, STN or GPI or whatever I have shown in last slide. So here they are selecting the target area, and once it is selected, they can program the device. Okay, coming to programming. So this is our lead actually, and we can select the pulse width, we can select the rate, and then amplitude also. We can select different levels of the electrodes, like these are the levels called. So eight levels. If you want to select the levels also, you can use these things, and then we can note the benefits and side effects of that particular therapy based on these parameters we are passing. So different leads have different behavior. So directional leads we can rotate also. We can visualize it more clearly because it is a 3D kind of lead. Currently, this is a standard lead method. So this is how they are selecting the benefits and side effects. And they can take a note of also their text notes. There is one text column. They can write down something, some summary or whatever they want to note down for that particular patient. That summary also they can write. So yeah, once everything is done, they can doctors can generate the report and keep it safe. They can export and keep it safe for next time, so that they can relate with the previous therapy before the next therapy. So yeah, that's it. That's it for the demo of the product. And these are the software technology we are using in our Boston Scientific. And this is a real patient testimonial video. You can see how we are impacting patients' life in real scenario. Audio is not. Okay, the patient is having this Parkinson disease. You can see his hands are just moving here and there. He is not able to take even. He is not able to take this glass of water even. His hands are shaking too much. See, he's not able to do it. He's not able to do his daily activity even because of this disease. And the doctor is noting down all his problems, what he's facing, and after that, doctor will decide which lead and what are the therapy they have to give to this patient. And he's asking how he's feeling. Yeah, you see that? Here it was like this. Actually, he's so emotional, and his family is also so emotional by seeing this change, this big change in his life because of our product. He is able to drink water, he is able to take the glass. See? And that's how we are impacting our patients' life. I hope you like it. Thank you so much. Thank you so much.
Thank you. This is not magic. This is technology. This is innovation, guys. That is what we do at Boston Scientific. We keep the patient at the forefront of whatever we do. By the way, I mean, thank you, Dr. Bhavna, Dr. Monica, and Dr. Sunil. Without the aprons. Didn't they sound like the doctors? Guys, come on. Did not they sound like doctors? But they all are engineers. And this is how we work. We have to understand, we have to get in their shoes to understand the real problem, to understand their needs, and then to provide the solution. Now, with that, I would like to call upon Tejas, who will talk about the context, the problem statement. Over to you, Tejas. Please pay attention to that. Thank you. Most important part. Yeah, most important part of this event, guys.
Thank you everyone for attending this session. So we are very last. We are two very last part of the session today. So I quickly talk about the competition. Go to the next slide. And we now go to the subject. So quickly talk about. We are here to provide the context, the competition, so we can provide a simple solution. Since to motivate you to kind of think in the innovative side and kind of come up with the good solutions so that it will help going forward in your career. So the contest will be a big presentation with the overview of your product idea. You can come with a team of 5 and maximum teams for institute. We are going to the group institute completely. So we need two teams from every institute. You need to submit your entry by the end of 22nd September. You need to submit your idea before 6th of October. We'll ask college to kind of nominations from college. So we'll accept 2 entries per college. The format would be you need to present a presentation at our campus. So you will be accompanied by the professor. They have come to campus for the final event. You need to prepare a 3-size poster in PDF format, and you can share your files to my email ID. You need to copy your leaders, your professors, or any your principal or your HOD. You can share your ideas on this email. And share this email ID your college so that you can share your ideas. So This would be the assessment criteria that will be assessed. First, it's introduction. To understand the problem, then competition, idea needs to go with the intellectual property, the solution, function, you need to for the NPT process, that's the key inputs to understand for assessment. So this is the intra-college competition. As I said, there will be participants from 4 colleges. Competition date will communicate with the principal and your HOD. The venue would be academic campus in Palewadi and Palewadi, so ideal presentation will be of 25 minutes. Plus, you will have 5 minutes of question and answer session with the jury. So that's the kind of competition overview. So we will announce winner on the day of presentation and question answers. And award prizes, winner will get 50,000 rupees and runner-up will get 30,000. So there will be 2 winners from 8 entries that wins. This is the problem statement. I won't talk much about the problem statement. The idea is to go and do the literature review, literature search, get an understanding. As everybody explained, don't jump to the solutions, understand the problem first, and then come up with the solution. So if I briefly talk about the problem statement is design a portable and compact automated drug delivery device used for continuous and precise intravenous and intramuscular administration of a prescribed drug. So you might think this problem statement a bit tricky because you might not be aware of the terminologies that have been used. But idea is to you go through the terminologies, go through the literature review, research, and come up with a solution. So just to give you a brief, are you aware of what is intravenous or intramuscular? What is intramuscular? Can you give it that? Was COVID vaccine intramuscular or intravenous? And what is intravenous? So, idea is, I did not expect you guys to know these things. It's good that you know that you are aware of this terminology. It's kind of very easy to not explain and go into the details.
You will have more than 20.
Yeah. So if you receive good idea, then we expect more entries from you. We can allow more entries from this college as well. So any questions on the problem statement specifically? Right? We won't go into much details, but just anything you want to understand more. So
Any of the previous slides.
yeah, and any of the previous slides of the competition format. So just to give an idea, this solution would not be either mechanical, electrical, electromechanical, or software. It could be a combination of all the branches. So it could be only software as well, only mechanical as well, but then we encourage you to kind of do the solution which will combination of all the branches. So this is an open problem statement. You can go to the literature research and come up with a solution. Idea need not be a concrete idea. It could be just a raw idea by following the NPT process or the product development process that we discussed. It could be very raw idea, but you need to present it well. You have to display that you have followed the process. You have to create the literature research. Anything you want to know about the more about the problem statement, you can ask questions. We'll share this problem statement with you.
Any questions? Overall presentation. Want to go back any slides and understand a bit deeper? I can do that. I think online. Anybody from online? Okay, so can you explain me why we are here? Can anybody add any idea why we are here and give us some time with you guys. What is the benefit I will get, or what is the benefit you get? Teacher से बोला इसलिए करते हैं, right? See, if you see the waterfall diagram, जहाँ पे user needs a design process, design output diagram, right? So you've seen that user waterfall diagram. So it's a typical new product development in every industry. The medical device or automobile. Pune is automobile hub. Go to any Tata Motors or Force Motors or anything, you will find similar process there. So where is your contribution? Can you please explain that? Username, design input, design process, design output. Can you please explain what you guys doing to complete your graduation? No idea? All are entrepreneurs. See, this college actually, every college in India or across the world, they explain you the design process part, only the design process part, the core engineering aspect of any problems or any solutions. Okay, they never teach you where the problem came and how the problem, how once you find a solution, how it is going to impact the society. Okay, so every whether you want to mechanical engineer or electrical engineer, software engineer, they will teach you how best you can learn that subject, mechanical engineering or electronics or software. But how it's going to be used in the industry, that is something which you should learn. And I think the reason why we are here right now, for us, it is to embed those larger thinking to you guys so that you can think in that terms. Right? So now you are learning all the formulas, everything, right? And they are judging you based on the formulas. But once you come out of this education bubble, they are not going to, the people who are sitting above you, they are not going to decide you based on how good you are in that particular formula or you are in that particular, how good you have done that coding. Okay. It is very important that there should be some kind of a solution coming out of that, and that's the reason why this particular session, this type of sessions are very important for you guys. Think beyond what you learned in this bubble and try to demonstrate that by going through this simple product statement. It's a very simple product statement. It's as good as a syringe. We need an automated. That's it. Okay. So now use your engineering skills. On top of that, try to incorporate all your user needs, how you capture your user need, how you documented those user needs, design inputs, and what kind of new product development process you follow to kind of put that product out in the market, and how do you verify? Okay, if you want to talk to a doctor, if you want to talk to a nurse, to understand the problem statement in depth, do that, or you can read some literatures and try to understand the problem. That's the overall idea of this entire competition. That for you guys to think in that aspect rather than formulas and assignments, just think in that aspect and try to find. Okay. Any other questions?
Just one thing. So, we'll be giving some prizes as a part of this competition. That is to encourage you to, as everyone discussed, to protect your idea or going forward and create prototypes, anything you want to do. So that's just to encourage you, and we are here to give you the insights of how industry works and how outside of this campus how industry works. That's what why we are here for. Any questions on overall?
I heard some.
Thank you everyone for listening us so peacefully.
So how many?